Good health is something that's important to all of us. Strong, healthy people help build and contribute to a rich and vibrant society. In Africa, millions of people are dying from easily preventable and treatable diseases like malaria, HIV/AIDS and tuberculosis, simply because they have little or no access to basic health care.
HIV/AIDS, TB and malaria contribute to more misery, to more death than all the wars that Africa has known, or the famines that Africa has known.
Every 30 seconds, an African child dies of malaria. Every year, 2 million people die from AIDS-related diseases. AMREF is working with African communities and governments to stop more people dying needlessly. It's a uniquely African organization, and more than 95% of its staff are from Africa. AMREF trains health professionals from across the continent and sees community involvement as the key to success.
The critical failure in African development has been the failure to find the building bricks within the cultural knowledge systems. You see, sometimes people go into our community, they do things all by themselves. Then when they want to go, they say, take over. Then the community stands back and says, well, this was your program. This is your project. So take over from where? So it is very important to involve the people from the beginning, and that's what AMREF does very well.
Hundreds of miles from Addis Ababa, the capital of Ethiopia, AMREF is working in the remote region of Afar. The Afari people are traditional nomadic herders. They've retained a unique sense of cultural heritage. Many of them are unable to access basic health care. We spoke to Hasina, whose twins contracted malaria last year. Unfortunately, Hasina's story is not uncommon. Something as simple as a mosquito net hanging over a children's bed could have prevented their deaths. Providing healthcare in these areas is a real challenge. But together with the help of local communities, AMREF has been able to distribute 90,000 mosquito nets, helping to protect over 450,000 people from malaria. Community education is also a vital part of AMREF's work, helping local people to realize the importance of mosquito nets and the danger signs of malaria. Thanks to AMREF's work, Hasina and her other children now stand a much better chance of leading longer, healthier lives. South Sudan is one of the most challenging environments where AMREF works. 21 years of conflict have devastated the country's health infrastructure. Now there are just 80 doctors and 600 nurses serving a population of over 8 million people. Here, AMREF is training clinical officers who will be able to treat a wide range of diseases and be able to perform minor operations. This is the only facility of its kind in an area 4 times the size of the UK. One of the students, Cholma Jok, was forced to become a child soldier during the war.
I personally went to the bush when I was 14 years old. And from that time up to today, I've been affected mentally, physically, in any way. But with the time, the trauma that I had is going slowly, gradually, with the peace.
Now he has an important goal.
I want to be a clinical officer to help my people who are actually in need of health services. And I choose this field because I dream of it.
AMREF is making a difference, but South Sudan is still in dire need of support and faces a major health crisis. In the heart of Kenya's capital, Nairobi, is Kibera, East Africa's largest slum. This is one of the most densely populated places on Earth. Here, 1 in 5 people are HIV positive. AMREF runs one of the few health clinics, but recognises that free drugs are nothing without education and community support.
Kibera is one of the largest slums, one of the worst in the sense that it lacks so many things. So to have succeeded in having a caring community where people care for those who are infected and the infected care for one another and the family accept them, we think that this is a very good example from which a lot of other areas can learn.
George is a community health worker, inspiring others struggling to come to terms with their HIV status.
As a volunteer here, my life has been revived because I had lost hope. But after getting attached to AMREF, I could access free treatment, I could get free drugs. So I was now able to take care of myself and my family, as well as help the community.
Every week, George runs a group therapy session. Joyce and Cosmos are both HIV positive. They are one of the hundreds of families for whom the Kibera clinic is their only lifeline. A few years ago, Joyce weighed less than 5 stone and was close to death. With AMREF's support, she and Cosmos have been able to access life-prolonging treatment and are now strong and healthy.
With me, I can say if AMREF was not to be supplying this easy to get us drugs, it could have been difficult for us to survive. Maybe we could have despaired and now say, let us die.
Joyce and Cosmos accept that they're unlikely to see their son Boaz grow up to become a young man. But their dream is to live long enough to see Boaz finish school. The medication and support provided by AMREF has extended their lives to make this modest dream a reality. The challenges of providing effective healthcare in Africa are enormous. Yet AMREF is helping communities to take a stand, African people coming up with African solutions.
That person who has contributed a shilling is a member of the big AMREF family. And they should feel proud that what that shilling has done, it has been used and has helped and has changed the life of somebody somewhere in a distant place. I think they should feel, yeah, I've contributed something to humankind. And we are very grateful for that.
AMREF can stop African children dying from malaria. AMREF can train more health workers. AMREF can help people living with HIV lead longer and healthier lives. But only with your support.